Welcome to this Evenings with Genetics webinar on From Stress to Strength. You are not alone. This webinar series is sponsored by the Department of Molecular and Human Genetics at Baylor College of Medicine and Texas Children's Hospital, and we're really thrilled that you all are here this evening. We really want to thank our donors, Genetic and Genomic Services, as well as Nancy Parkhurst. And we are not only grateful for their support, but we welcome yours as well. We have a great panel of speakers tonight, so we're really excited about this webinar and so happy that you all are joining us. I would like to open with a brief introduction to the From Stress to Strength program, and then Gladys Pryor, my successor, will introduce all of the other panelists. So I'm Susan Fernbach. I am a genetic nurse with degrees in Spanish and nursing, and have been in the Department of Molecular and Human Genetics for 38 years and have been directing this series for the past 16. But I am going to be retiring, and I am delighted to announce that Gladys Pryor will be my successor. So we're going to go through a few of the little intro slides, but I want you all to sit back, take some slow, deep breaths, lower your shoulders, and relax. We have a great program this evening. And why do we think this is important? Really, it's because studies have shown that there is high stress, anxiety, and depression in parents and caregivers of children with neurodevelopmental disorders. However, most of the services are for the child with intellectual or developmental disabilities or autism spectrum disorder. So in 2014, a paper in pediatrics was written by Dr. Elizabeth Dykins with the Vanderbilt Kennedy Center for Research on Human Development. And they did a study where they looked at two factions, one being the mindfulness-based stress reduction program, and the other a positive psychology program with trained peer mentors to see if they could reduce the distress of mothers of children with disabilities. After 6 months after the program, parents continued to show improvement in distress, anxiety, depression, and insomnia. And that was the end of the research study, so they didn't follow the parents after that, but they were very pleased that it was for that period of time. So we read this paper and began using this program From Stress to Strength in 2015, using the Vanderbilt Positive Psychology program. Our program focuses on the parents of the child with intellectual and developmental disabilities or autism spectrum disorder, and we include both parents if they are interested and caregivers of the child. Multiple departments became involved, which is really incredible and doesn't typically happen this way. Not only our genetics department, but developmental pediatrics, transition medicine, neurology, psychology, psychiatry, graduate students, and parent facilitators are a very important part of this. And we began an English and Spanish track. So tonight, we're going to discuss some of the strategies of the program, and we fully recognize that they can benefit all of us. And so we welcome you to this program. And I'd like to turn it over to my successor now, Gladys Pryor.
Thank you, Susan. Good evening, everyone. So my name is Gladys, and as Susan said, I'll be her successor. But first, I want to introduce the panelists tonight. Dr. Leandra Berry is an assistant professor in the section of psychology within the Department of Pediatrics at Baylor College of Medicine. She's also a licensed psychologist and the assistant director of clinical service in the Autism Center at Texas Children's Hospital. Dr. Berry provides clinical assessments to patients in the Autism Center and evaluations in the autism spectrum disorder studies. She has been a facilitator for the From Stress to Strength program since 2016. Ms. Wei-Chen Chen is a community advocate and has had the role of parent advocate for 40 years. She immigrated to Houston at the age of 15 and studied computer science in 1970s. She has 4 grown children and 4 grandchildren. For the past 5 years, due to general interest, she and her husband have been attending this monthly Baylor College of Medicine genetics series that before the pandemic was held at Houston's Children's Museum. And in 2020, she became involved with the Stress to Strength program as a parent facilitator. And we are grateful that Ms. Chen has joined the superb group of parent facilitators. And then there's Dr. Jordan Kemere. She is an internal medicine physician and assistant professor at Baylor College of Medicine, where she provides primary care to adults with intellectual and/or developmental disabilities. Dr. Kemere works closely with partners at Texas Children's Hospital to improve transition from pediatric to adult healthcare. Dr. Kemere has brought the wonderful addition of transition planning tips to the From Stress to Strength program. And thanks to the Ligham's Family Transition Medicine Grant, we will be able to offer the full program this fall. And you'll hear more about this. But for now, let's get Dr. Berry and get this program going.
Hey, so I am honored and very pleased to be here tonight to talk to you all about stress management and self-care and emotional health for caregivers. I'm going to spend a few minutes talking more about the From Stress to Strength program, and then the rest of my portion will be focused on different stress management techniques that you might find helpful in your day-to-day life. So the From Stress to Strength program, as Susan mentioned, is based on the Positive Adult Development curriculum. And it was created to help parents of individuals with IDD, intellectual and developmental disabilities, manage stress. It incorporates evidence-based interventions from the field of positive psychology. And it really emphasizes ways to manage emotions such as guilt, conflict, worry, and pessimism by identifying and using character strengths and virtues, using strengths in new ways, and practicing exercises involving gratitude, forgiveness, grace, and optimism. The curriculum for From Stress to Strength and exercises that are also included in that program are derived from what the disability field and parent group supervisors at the Vanderbilt Kennedy Center concur are best practices. These include advocacy training and navigating multiple service delivery systems as participants learn and practice strategies that are applicable at different life stages. So this might be starting from early intervention to educational programs and systems, and later on to vocational systems. Another strategy is using parent-to-parent emotional, or best practice rather, is parent-to-parent emotional support and sharing of strategies that really optimizes parent and overall family functioning. Learning and practicing specific stress management techniques, including exercising, allowing time for leisure activities, thinking positively, getting organized, and avoiding too many commitments. Another best practice is sharing techniques to address child-specific behavioral challenges that participants bring to the group. And finally, learning and practicing specific cognitive behavioral approaches to reduce negative thinking and enhance more effective problem-solving skills. Here is kind of an overview of the program topics that are included in From Stress to Strength. The first 3 topics are covered in day 1 of the program, which occurs on a Saturday morning. And again, you'll hear more about this later. The 4, 5, and 6 topics are included in day 2 of the program. And then there's a separate topic that's kind of our own unique addition to the From Stress to Strength curriculum, which is a 90-minute webinar focusing on tips for transitioning from pediatric to adult care. And you'll hear more and more about this program later on in the presentation from Dr. Kemere. So let's spend a few minutes talking about and thinking about what self-care actually is. So self-care is the practice of taking an active role in protecting one's own well-being and happiness, in particular during periods of stress. So in other words, the practice of taking some action to preserve or improve one's own health. This can be any activity that we do deliberately in order to take care of our mental, emotional, and physical health. Good self-care really is key to improved mood and reduced anxiety. It's also key to a good relationship with oneself and with others. So how about what isn't self-care or what self-care isn't? So knowing what self-care is not might be even more important. So it's really not something that we force ourselves to do or something that we don't enjoy doing. It's really something that should refuel us rather than taking from us. And self-care isn't a selfish act. It's not only about considering our needs, but rather about knowing what we need to do in order to take care of ourselves, being subsequently able to take care of others as well. So that is, if I don't take enough time to take care of myself, I won't be in the place to give to my loved ones either. So stress is one, unavoidable, and two, comes from many sources. It comes from everyday challenges, like for example, for me, realizing about an hour before the presentation that I wasn't going to be able to see my notes. So I had to do a quick improvisation. I said, you know what? There's always some issue when it comes to Zoom presentations, and it's just part of life. So there was a stressor right there for me sharing my own personal experience. Stress comes from input from our family, friends, and community. While often well-intentioned, that input can still not always be helpful and may sometimes be hurtful, even again with the best intentions from our family and friends. Stress can come from what we're worrying about for the future, for ourselves, for our children, and for society as a whole. Stress can also come from financial strain, and particularly now with our economy and rising inflation, everything is costing more, and that's putting a strain on everyone's pocketbooks. And then also stress comes from navigating the many sources and institutions that we have to deal with. Schools, therapies, insurance companies, doctors, behavioral health professionals, community services, and many, many more. Let's talk a minute about the mind-body connection, which I suspect many of you may have heard of or are familiar with in some way. Basically, what this illustrates is that feelings, thoughts, and behavior are all connected and influence one another. Thoughts and emotions are related, and emotions and physical well-being are related as well. So our emotions, particularly those that result in us feeling stress, can have a negative impact on our physical well-being. So let's talk about managing stress. How do we make decisions to actively reduce our stress loads? How do we cope with stress that we can't get away from? Because again, stress is part of life. It's unavoidable. We're never going to live a stress-free life. It's how do we cope with that stress that really matters. So let's talk about a few strategies that we often want to use that frequently seem to work in the short term, but cause more problems or stress in the long run. Ignoring and avoidance both appear to work in the short term when you're confronted with a stressor. So for example, maybe you get a credit card bill in the mail and you don't have the money to pay it right now. So this elicits a stress response in you. You might become like your stomach might start to hurt, you might get a headache, you might start to have worrisome thoughts. So you decide to use a coping strategy of avoidance. So you put the bill in your desk drawer and you say, I'll think about it tomorrow. Then when tomorrow comes, maybe you say, oh, maybe the next day, or the next, and so on and so forth. In that moment, this really does help you cope with the stress. So when you're deciding not to think about it right now, some of those physiological symptoms might go away. But ultimately, in the long run, 2 weeks later, you get another letter in the mail and it's informing you that your payment is late and now you're going to be charged a late fee. So in addition to your initial problem, not having enough money to pay the bill because it was too big, that's just increased, and correspondingly, your stress increases as well. We know the same thing applies to cognitive avoidance. So trying to suppress a thought or just not think about something, it doesn't work. This takes a lot of energy, and also in the act of making sure that we're still not thinking about something, we think about it, right? So if I say, whatever you do, don't think about a white elephant, you're going to think about a white elephant. It just doesn't work. Thought suppression in that way. The checking behavior involved in cognitive avoidance leads us to inadvertently dwelling on whatever it is that we're trying to avoid. So how about some effective strategies? So these include things like communicating and sharing our emotions. And this has been shown to be associated with improved health outcomes. And this might include things like conversations with friends, with therapists, journaling, things of that nature. Seeking social support, adjusting your perspective or adding additional perspectives to how you might view a situation. Are there other ways that you can interpret a situation? Maybe there are some parts of the experience that you can't change or you can't control, but you can control your response to a situation. And then thinking about, is stress a challenge or a threat? And then also there's this concept of emotion regulation, or the ability to successfully control one's own emotions. We'll talk more about that. So related to this concept of emotion regulation are different ways of coping. So the kind of two broad areas include problem and emotion-focused coping. Problem-focused coping is really all about trying to eliminate or reduce the stressor. It's about minimizing the cause of the stressor, whereas emotion-focused coping is all about managing your emotions in response to a stressor. So that's really about your reaction to a stressor. With problem-focused coping, it often looks like this. You define the problem, generate alternative solutions, and then follow a plan of action. With emotion-focused coping, this often involves things like seeking emotional support, engaging in positive reappraisal, sort of like seeing the silver lining, expressing emotions, using relaxation strategies, and engaging in distraction, which is not necessarily the same thing as ignoring or avoidance. Okay, so there are a variety of emotion regulation skills and strategies. And we frequently will split these emotion regulation skills into these kind of two broad sets or categories. One is called distress tolerance. These are intended to be used in situations that are or currently seem to be unchangeable or unsolvable. Distress tolerance skills include things like distraction, self-soothing, and this can be via all five senses. So it might be looking at art, listening to music or a book on tape, going outside and smelling the fresh air, going to a coffee shop, getting a massage, petting your dog or cat, putting on more comfortable clothing. Improving the moment is sort of like taking a mini vacation. So maybe you just lay in bed under your covers for 20 minutes, or you take a day trip to see a friend, or you hang out at the park when it's not 100 degrees outside and just enjoy the beautiful fresh air. A second set involves general problem solving skills. So here, one would brainstorm solutions to the problem, identify those that are most relevant, and create an action-oriented plan. Then implementing that plan and really evaluating to see if that plan was helpful or not so helpful, revising the plan for next time, and then rewarding yourself for executing the plan. A third skill that's worth considering is something called opposite action. When we experience an emotion and it doesn't fit the situation, we can engage in an activity that elicits or brings out sort of the opposite emotion, or perhaps we can do some behavior that results in an incompatible emotion. So let's take a look at some examples of this. So let's say you're feeling anxious and you're avoiding a situation or task. In that case, the opposite action would be to approach instead of avoid that situation or task. As another example, if someone is feeling sad and they want to withdraw, the opposite action would be to get active, to schedule an activity, to do something enjoyable. So this is different in that frequently when we experience an emotion, we want to engage in a behavior that perpetuates the emotion, okay, right? So I'm feeling down, I had a lousy day at work, I'm gonna go home and watch The Notebook and cry my eyes out, right? But no, opposite action says instead of watching a sad movie when you're feeling down, especially if you're feeling down for no specific reason, you should do the opposite of what you feel. Go watch a comedy instead. Okay, so this is just sort of a basic checklist of different self-care activities that any one of us could engage in. So creating a no list is a great idea. I love this concept actually. So the no list is really things that you know you don't like or you no longer want to do. So this might include not checking emails late at night or even after work hours, not attending gatherings that you don't like, not answering your phone during lunch or dinner. Of course, we all should strive to eat a healthy diet. In reality, You're not always going to have a healthy diet, and that's okay. So practicing a little self-forgiveness is also really helpful in managing stress. Trying to get enough sleep. So remember, adults usually need about 8 hours of sleep per night. I know most of us don't get that, but it's something that we should strive for, and we can get that much sleep. If we can, we should. Exercising, following up with our own medical care, trying to do at least one relaxing activity every day, whether it's walking or spending 30 minutes unwinding, trying to do at least one pleasurable activity every day as well, from going to the movies to cooking or meeting with friends, using relaxation exercises or meditation, spending enough time with those that we care about, and really finding opportunities to laugh. A few other suggestions include learning to identify when you need a break. I think we don't always do a good job of recognizing when our cup is full and we need to just take a personal time out and walk away, even if it's for 5 minutes. Just sometimes you need to take a break from the situation, and then allowing yourself to take that break and not feel guilty for taking that break. Asking for help. There are times in our lives when all of us need someone to help us, and there's no shame in asking for help. Spend time doing things you enjoy, as I mentioned previously, and look for additional sources of support in your life. A few more strategies for managing stress include developing a forgiving style. The strength of forgiveness has been shown to have a powerful buffering effect on stress. Those that are very forgiving of themselves and others have far less chance of having mental illness. One team of researchers explained that forgiveness takes the bad connection between mental illness and stress and makes it almost zero. Without forgiveness, we experience stress in a more raw, unblocked sort of way. If you find yourself uncertain on how to be more forgiving, you might set up a letting go practice, starting with little things. So like maybe somebody cuts you off in traffic or seems to ignore your hello at work. Happened to me today. So here you could take a specific approach of letting go. So here, something little yet distressing happens, pause, take 2 slow breaths of fresh air, and then say to yourself, it's okay, I can move on. Improving your planning has been shown to also be an effective strategy for managing stress. And stress management research has made it clear that stress can really can effectively be reduced through planning. So start making daily checklists, dust off your planners, and take action by getting organized with your weekly activities. Practicing gratitude, both spiritual gratitude as well as counting daily blessings, has also been shown to have a huge impact on stress. So here you might start by setting up a nightly practice where you write down 3 things that you're grateful for and explain why you believe those things happened. So try not to repeat the same thing on the list from day to day. And if you keep up this activity over time, you'll have hundreds of examples of gratitude by the end of the year. Okay, so let's talk a little bit more about this concept of mindfulness. So mindfulness is non-judgmental, in other words, don't beat yourself up, present-minded awareness, not past or future kind of awareness or focus. So why might this kind of acceptance be important? Are there certain situations where acceptance is important? Yes, because 1, we cannot change everything. And 2, sometimes life isn't fair. We have to really find this balance between advocating for ourselves and accepting situations. Although acceptance is not the same as saying, this is good, I approve, right? It's really more about recognizing what is and what is not in our control and making choices about where we want to direct our energy. So one fun little exercise that you might try is called the mindful pause, which is really a simple 2-step approach where you pause before or during a stressor and really pay attention to your breathing for about 15 seconds. Then after that, you ask yourself a question. How might I use one of my own character strengths right now? Then you're taking positive action with any character strength that might pop up. To live mindfully and to live in the moment and reawaken oneself to the present rather than dwelling on the past or anticipating the future. Mindfulness can also be a really healthy way to identify and manage underlying emotions that might be causing problems in our personal or professional relationships. Mindfulness is often used in meditation and certain kinds of therapy. It's been shown to reduce stress levels, reduce harmful rumination, which is kind of repetitive thinking about something, and protecting against depression and anxiety. And research even suggests that mindfulness can help people better cope with rejection and social isolation. At best, mindfulness is a tool that allows people to be more aware of their physical and emotional conditions without getting stuck or bogged down in self-criticism and judgment. And lastly, I think it's really important that you use the strategies that work for you. So I've talked about a few different strategies this evening. Some will work for some and some will be less effective. So really kind of trying out some of these different strategies and figuring out which ones work for you and which ones don't, and do the ones that work for you. Thank you so much. And now I will pass it over to Wei-Chen.
Thank you, Dr. Berry. Without knowing this thing that Dr. Berry just mentioned, she mentioned the phrase, the mindfulness pause, and I'm actually using that in one of the events that happened recently, and I'm going to share that with you on my following talk, okay? So pay attention to the mindfulness pause. Okay, so I realize each of our journey are unique and personal. To me, it's the process rather than the sequence of events that happen in our life with our children. And it's the tidbits, to me, it's like little things that happen rather than the history. So be present, in other words. And I also like to separate the diagnosis and the person, because that helped me tremendously, okay? And focus on the person, not necessarily the diagnosis. But I try not to separate the person and the behaviors. I do have to address the behavior without kind of resort to that's just the way he is or she is. And we try to do that the best we can. So tonight, I have no PowerPoint to share, but I do suggest you close your eyes and reflect in your own journey. The following 20 plus points, what I call my learned bullet points that I'm going to share with you. Point 1, I like to call our children the special ones, which include all the children, regardless of age, that are living with either a congenital condition, whether it's genetic or circumstances. We are blessed that the condition that we encounter usually not a sudden attack or accidental cause, where we have very little time or control to manage it. So I think you all see the picture that's displayed. It's a tree. It's a pendant tree from Maui. And the reason I picked that picture, because it depicts very well my point of view on my journey with my special ones. Point number 2, this is a disclaimer. I speak from my own experience of trial and tribulation. Each one of us do have a different personal journey, and I do value the uniqueness very much. I like to share what I have learned from the journey with my 42 years old daughter. Keep in mind, it's still an ongoing journey for me. Point 3, it's not the kind of journey I planned it or expected, but I'm expected to support her as my loved one in her journey of progress by facing her reality, my reality, and accepting our problems. And guess what? The journey so far for me and my daughter are filled with courage, discourage, challenges, frustration, persistence, perseverance, progress, purpose, peace, and joy. It's a mirage of emotions, which to me is living to the fullest. Point number 4. The goal for me is not to make it right, because it was never wrong to begin with, but make it better for the benefit of my special one or your special one, which in turn also is beneficial to the entire family, if not the community. Point number 5. To me, support group is the real lifeline and the front line of supply chain. It's also the best therapy for the caregiver. I cannot describe fully here about how support group benefit me over the past 4 decades. But I invite everyone to belong to a special support group. Number 6. I like to focus on the important issues during each phase of my special one's life. For example, right now, for the past 5 years, I have been continuing to focus on an independent living plan and will continue to do that for another 5 years, right around the time she turned 50. So that's the special phase for me and for her. Point number 7. A little understanding goes a long way. The special one does not need much. They just need a little acceptance, a little kindness, some attention, little connection, and dabbles appreciation. Dabbles appreciation, I mean. Point number 8. Each family member actually benefit from the real life lesson learned while riding through the challenges that we face with our special one. A lesson learned over and over for me was to handle the frustration that I have to encounter, whether small or big, and not that the negative energy drain me out. And I'm going to give an example. So this happened last week, and the whole event began in February when my daughter's ENT suggests sleep study. So in April, we first tried the at-home sleeping kit device, which involved a little plastic tube that you have to stick in your nose called cannula. And without me knowing it, because we never done this before, she refused that thing in her nose. And she is known to take all kinds of needle, all kinds of procedure, but no cannulas. So I had to return the device without collecting the data. Now, after 5 months of back and forth and try to convince her, that we decided to give another try in September, early September. And fortunately, our provider has a new way to do sleep study at home. It's with a watch called a sleep watch pad, which I'm thinking, oh, that's great. It's not invasive, and she had no reason to reject that. So we did it on a Friday. And then at nighttime, 9:30, I'm ready to hook up that device. And I'm actually familiar with that device because I've done it twice for a special clinical study. Lo and behold, 9:30, after we connect the 2 connectors, I got a board message, says abort 20. So on the pamphlet, there is a device help desk. You call them. Now I'm encountering another frustration following this. After 4 phone calls from both my AT&T landline and also my Verizon wireless, 4 times, after like a couple minutes of conversation, the phone call was dropped from my end. The customer rep claimed she could hear me, but I don't hear her. So I was not able to resolve the issue other than there's some kind of problem with the device. So the next morning, we dutifully returned the device to the provider. And I explained the problem we have. And she was able to reset the device. So we tried again, on the following night. This is the third attempt, okay? And I forgot to mention how frustrated I was, on the night before when I made that 4 phone call and nothing works. So I want to talk about the frustration, the defeat, just endless at that point. And that's when I tell myself, I did all I could tonight, and I need to pause for a good night's sleep and deal with it tomorrow. So this is where Dr. Berry's mindful pause comes in. And I didn't know I was practicing that. But because the situation I was faced, I had no choice but to go that direction. So that's what I want to share with you, this particular example that we do constantly deal with frustration, with discouragement, with hopeless, with defeat. But it doesn't last. It should come. We should be able to come out from that after a pause, after a resettlement, after a recharge, after a renew. So there's hope behind all that. Point number 9. My motto after 40 years is, I did not raise my special one, but she raised me. How did she raise me? To be a better person with patience, compassion, endurance, perseverance, perspective, and then come faith, hope, and love. Point number 10. We need to model to others how we truly value and embrace our special one, because no one else is better suited. Point number 12. When the going gets tough, allow yourself to pause again here. Then you wait, then you refresh for next revival. Do not spend time in the negative zone. Just stay in the neutral zone for a while and ready to cross over to the positive zone when you're ready. And then your special will be ready with you. Point number 12. Be a creative problem solver and realize there are lots of repetitive with regarding to their behaviors, their routines, their activity, their negative reactions, their difficult situations. There are many evaluations. There's many applications for services. There's quite a few advocacy we have to do, a few therapy sessions, and definitely a list of medications. That's what we have to deal with. And we need to be a creative problem solver to resolve most of the issue. Point number 13. Sometimes I do feel like after I took one step forward, immediately I follow by one backward step. To me, that is still progress, because without that forward step, it will be regression, which we do not want to have. We might be running against time or pressure by time, but as long as we are moving, we are all right. Point number 14, transitional time, which we encounter every 15 years or so. It's very scary due to unfamiliar territory, but it's a natural progression that I walk through with my daughter, which actually empowering her and reaffirm me as a mother. It's an important milestone for our life as mother and daughter, as supporter and participant, as advocate and operator. I'm the advocate, she's the operator, as friend and friend. So those are the kind of relationship you build together through all the transitional time. Point number 15. Do value and collect all the little joyful milestones and memorable moments as treasures, because they don't come easy and they are worth it. Point number 16. Our special one knows and appreciates us as their lifelong loving caregiver, in addition to mother and friend. Point number 17. I do feel very grateful to everyone who paid attention to my daughter, provided services over the years, supported her in kindness, and knew her as a real person. For me, it's better to gather the little hidden rocks and not necessarily the nicely shaped, smooth, large rocks. So that's just like a, an analogy to me. Point number 18. I want to talk about the Stress and Strengths program now. It's such a mindful program to realign parents to the nature and nurture state of mindset. And I also realized an antidote recently during one of my exercise routine, which I do regularly. And I come up with this phrase, okay? This is stress to stretch to strength. That us neutralizing our stressful circumstances by stretching our mind to strength. By stretching our mind to strengthen our perspective by special strategies. So I'm using a lot of, S word, stress, stretch, strength, strategies. It's all connected. Number 19, it's very natural to worry about something. And we do it all the time, even with typical kids too. But it's unhealthy to be worried about the same thing for a long time. So I like to use the analogy of daily worry, where we focus on what we are today's top 3 worries and inventory all the other worries, okay? So they typically tell you to pick 3 problems. I like to pick 3 worries and just focus on them, and could be a different 3 worry tomorrow if I want to. So that's apply our energy on resolving worry and not consumed by them. Number 20, which is my final point, by the way. I never gravitate toward the term multitasking because it does not make sense to me. I prefer multi-planning and mini-tasking, which means I'm constantly planning to adopt, but can only do mini-tasking to react. So that's been my strategy, one of the strategies that kind of helped me and not get drawn to the negative zone too much. So what I just shared, the 20 tidbits, works very well with my non-special children also, because it's all about life in general. As a parent of special one, I'm very grateful for the opportunity of lifetime to be trained and learn the best strategy as a parent. So please pat yourself on the shoulder, for you are all an expert, and say to yourself, well done so far, and continue trucking. Thank you for paying attention to what I have learned and able to share with you, and I'm definitely going to continue learning. So now it's my honor and pleasure to introduce our final presenter for tonight, Dr. Jordan Kemere.
I am just so thankful to get to be here tonight with you guys. I want to tell you a little bit about myself. This may seem like I am moving into a totally different area, but I'll show you in a second how it's connected, and then we'll talk a little bit about our program that we're offering. So what I do is I work in a clinic at Baylor, and I'm a primary care doctor for adults with intellectual and developmental disabilities that are over 18. That also means that I provide primary care to adults with IDD that are in their 60s. And I have people all in between there. And so we have a really neat clinic, and I see patients with all kinds of different diagnoses. I listed some on this slide. So I think some of you guys are very familiar with this, but what is healthcare transition? So when I first started this job several years ago, this is what I was excited about. And I still am excited about it, but I was really thinking carefully about what is transition And what we say is that it's really this planned process from moving from a pediatric to an adult healthcare framework. So a lot of people think, oh yeah, I'm going to transition from the pediatric doctor to the adult doctor. But for those of you that are in the middle of it and maybe have already gone through it, you'll know that it's not that simple. And I made a long list of things that you have to think about and assess and deal with and worry about and plan for that have to do with healthcare transition. So it's not just doctors, but it's also insurances and other ways that services are provided through waivers. It's daily activities for your special one, as Wei-Chen says. And it's also just your child learning how to be more independent, their own self-management. Can they take their own medications or not? Can they make their own appointments? What is it like the first time you have to go to an adult hospital? There's so many parts to transition. And this in and of itself can be really stressful. So when I talk to families, they often either bring it up in anticipation, like I've heard this is going to be stressful, I know this is going to be stressful, or they're in the middle of it and they're experiencing a lot of stress related to these particular topics. And so I think I put in a lot of effort and energy into trying to help make this process smoother and less stressful. But I'll tell you what, in my now 7 years working at this clinic, I have come to a more recent realization, and I think it's also through participating in the From Stress to Strength, that transition is actually just one little part of our journey. And so Susan, next slide. And so healthcare transition is actually not the only challenging part of the journey. And so I now regularly sit down with individuals who are in their 40s and their parents are in their 60s. I have patients in their 60s, their parents are in their 80s. I have patients who are in their 20s, their parents are in their 40s. Sometimes I even have 19-year-olds who have mamas in their 30s, okay? So I am dealing with caregivers of all ages and patients of all ages. And when you start and you sit down and you listen to them, I just listed just a few. These are big things. This does not include all the small things that sometimes make us even more stressed and crazy, like the watch pat. And I have had that story told to me by more than one patient that Wei-Chen shared tonight, right? And sometimes it's the little things really that can sort of set us off. But some of these things are big, right? And they're all throughout. Maybe when you first tried to figure out your child's diagnosis, right? That process is sometimes straightforward, but sometimes it's not. And that can be really stressful. When your child first went to school and learning what that's like to be around other people, to be out of your care. I had a conversation with a mom yesterday about raising her, neurotypical child and what the stress was with that in relation to her special one. Transition I mentioned, but also life after school. What does life look like for someone with IDD or autism in their 20s, 30s, 40s? What does independent living look like? And it's different for everybody. What happens? I can't tell you how many people, when I say, have you ever thought about what would happen to your child if you were to pass away? That's like a really heavy question, but it's something that people worry about all the time and they think about all the time. And so I didn't put up this slide to induce, stress and fear. I meant to put up this slide just to point out, actually, there's a lot of challenges that we're all going through all the time. And they keep coming and they're different. And you can't just stop learning when you're in your 30s or 40s. You got to keep learning all the way through. So what I wanted to say to you guys tonight is, no matter where you are, you're not behind. People come and they say, oh, I didn't know about this program or that program and I'm behind and I haven't planned for this. You're just not. You are where you are. And you're actually a lot more resilient than you realize. You have already overcome, being here tonight. I bet most of you have already overcome huge challenges and are currently overcoming some right now. There's always going to be another one coming. And you can actually always learn new skills to cope with stress. I've been fortunate to be with Dr. Berry and with Wei-Chen in several of these programs. And we have moms, like I mentioned, who are in their 60s and they are learning new stuff and they've been learning their whole life and they're still learning, okay? You can always reinvent your self-care. Dr. Berry talked to us a little bit about self-care and what worked for you for self-care when you were, let's just say for me, when I was 20 is not the same self-care that I needed when I was 30. And now that I'm in my 40s is not the same self-care that I needed now. What was refreshing to me when I was 25 is not refreshing anymore, and different things are, okay? So it's part of self-care is also to be, as Dr. Berry said, not doing things that you don't want to be doing, but doing things that are giving you new energy, and that changes as you get older. The next thing is you're not alone. There's so many people on this call even tonight, and the more I talk with families in clinic, I mean, I have hundreds of patients, you're not alone. And that community is really, really important. And I think Wei-Chen brought this up when she talked about being part of support groups. Having different kinds of community is also really important. And I think a lot of us have really felt that during the pandemic and then realized, wait a second, being with other people and having community makes a big difference. And then I also want to say, and this is maybe a little tough love, but a lot of people carry around this mentality of, I just need to get through this one thing. They don't want to learn new strategies. They don't want to do self-care. They just want to kind of clench their fist and say, as soon as I get over this one thing, then everything will be fine, right? And then it will be smooth sailing. I think most of you, if you can reflect back, maybe you did get through that one thing, but then another thing came. Right. And so I want us to lose that mentality of, if I can just get over this, then everything will be fine. I think most of us have lived long enough to know that life doesn't necessarily work that way. And that actually, even when we're in something hard, we still have to pause and think, what kind of self-care can I do? And what new skills do I need to learn? And so I want everyone here to try to get over that, drop that mentality, and instead kind of embrace a mentality where you're always going to be learning and you're always going to be adapting. Okay, next slide. Now, with that said, I want to talk a little bit about our program, and it's already been mentioned, but I want to present to you guys an opportunity to seize this moment and actually learn some new skills and be a part of a community. So we are so fortunate. We're going to be able to offer this From Stress to Strength program coming up, and I'll show you the information and how to register in just a moment. But we have 2 different weeks of in-person program. And the first week, what you guys will notice is it's really about assessment. You're kind of thinking, okay, where am I holding on too tightly? What places are there where there's grief that's no longer perhaps healthy or productive? And where am I feeling guilt that's not moving me towards healing or not moving me in a way that's positive? And we're really going to do some assessing that first week, and we do it together. There are psychologists and professionals that go over the material, but there's not that much material. A lot of it is actually us interacting together and talking together. And I think that's what's really, really powerful. And then we're going to come back in the second week. And so this is a total program. We want you to come to the whole thing. It's not just come to one and not the other. And in the second week, what we're going to do is we're going to actually move a little bit to action. And so look at these words like collaboration, confidence, optimism. We are going to move, and after we've done this initial assessment, and then move into some things that we can do that will be active. And then finally, for those of you who are interested, the third part is I'm going to talk for an extended period of time with the help of some of my social work team and really dive into some of this stuff on healthcare transition. And this will be a little bit less about strategies and a little bit more about what are some of the practical things that occur during healthcare transition, which can be very stressful, but also hearing from other family members. And I will tell you that in some ways, transition starts real early and it keeps on going. And so we have family members that participate in this who have little ones that are, 6, 7, 8. How can I start thinking about this? How can I start thinking about independence? And we have family members whose children are in their 40s and they are still thinking about some of these transition topics. So next slide, Susan. So what I'd like to do is I'd like to invite you guys to register for our program. And then if you can't do it, I also want you guys to spread the word. We think this is just a really powerful thing. And we're really fortunate to be able to do it in person. So I've put up the Spanish and English flyers. We're also able to send these out to the registrants so that you guys will have them. It's 2 different Saturdays. Both days we're going to have lunch. We're going to eat outside. We're going to be able to spend some time together at lunch that's unstructured. And then we're going to go through that program that I just showed. We have some availability for registrants for some stipends for childcare. So if you want to come, but you're going to need to get a babysitter, we'll be able to provide you guys with more information on that, when you register. But I think this is a great way to sort of take what we talked about tonight and then put it into action and say, I'm going to actually take this advice. I'm going to learn some new skills, and I'm going to step into some of this self-care. I do not have, I have 2 children who I love dearly, who have a lot of unique challenges. They do not have any genetic conditions or developmental disabilities that I know of, but they are always on my mind. And I have participated in this program multiple times now, and I always get something out of it. I tear up almost every time, and I don't cry on a regular basis, and I always get something out of it. So I think no matter where you are, where you're coming from, I think you will benefit from this. So I just thank you guys so much for being here. I think I am always encouraged by people that I meet in clinic, and caregivers and parents. And it's just been a real pleasure to be able to spend this time with you. Thank you.
Thank you, Dr. Kemere. Thank you, all of the speakers. I've been writing notes and have gotten a lot of information from each of you, actually. So thank you so much. And even though I've participated in this program for, I guess, the past 7 years as well. So let me see if I can stop sharing and we can answer questions. Fourth year medical student, but I found the webinar helpful. Applying for internal medicine and pediatric joint programs. Either way, I will likely be working with patients with IDD transitioning into adult out of pediatric care. Is there anything that I can do as a physician to be more helpful in this process? And Dr. Kemere, would you like to answer that?
Sure. I think that's a great question. I think the first thing that I always tell people, when you're dealing, when you're seeing a patient who has an intellectual developmental disability, the first thing is to remember that they are your patient, and to interact with them first and foremost, and that they are a person who have opinions and thoughts and ideas and dreams. And the second thing is that many of these patients will come with caregivers, and they can come in all shapes and sizes and relation, and that those caregivers are often experts in whatever the condition is, and that you are wise to listen carefully to what they have to say. And I often when I make care plans or medical decisions, I almost always say, mom or dad, and also to the patient, what do you guys think we should do? And so I think I've learned that in this particular population, our parents are often the experts. And I've learned more, I think, from parents than I have just from doing reading. And then finally, I think looking out for training opportunities wherever you wind up going for residency, where they actually take care of this population. And even if you only get to spend a week with them, learning, I think that that's really, really helpful. But I think basically being a great listener and then understanding who your patient is and treating them as an individual, I think those are the two most important qualities for sure.
Wonderful. And I agree. And Cameron, thank you for attending tonight, because I think part of our program has included medical students and graduate students in the past. And they have told us how much they've gotten out of these programs and thinking about the mindfulness part of this, the pause as we've discussed tonight, the ways to find their own strengths as they're going through some pretty stressful training times. And so I'm glad that you've attended. I think this is great. And I have a question, maybe Dr. Berry, if you could talk a little bit about reframing and how people can really think about doing that, because I think sometimes when you're sort of stuck in one mindset, it's really hard to then go into a reframing and be able to step back and see something in a different way. Does that make sense?
Yeah, I think so. Absolutely, yes. We are all at risk for getting stuck in thinking patterns. If those thinking patterns are positive, then it's not so much an issue, right? But if those thinking patterns are negative, it can be more problematic. So I think first you have to have some awareness and insight into your stuckness, right? And okay, this is how I'm looking at this situation, and some desire to want to change and to think about it differently. So first, kind of this awareness, insight, and then the second piece is motivation. And then I think brainstorming, right? Like, what are all of the different ways I could interpret this? How else could I look at this? And there's no right or wrong answer when you brainstorm, right? You take all ideas. And maybe that's just your own individual brainstorming, or you ask other people to brainstorm with you. And then you just sort of tell yourself, I'm looking at this a different way. I used to look at it this way, and now I'm doing it this way. And even though you may not be 100% sold on that, I really, back in the day when there was MySpace, I had a mantra on my MySpace page, and it was fake it till you make it. And I 100% still believe in that, right? Your behavior can change your thinking. It's hard to really directly address your thinking patterns and change those, but you can control your behavior much more easily. And by changing how you act, that can change how you think and how you look at situations. So I hope that answered your question, Susan.
No, that's great. That's a great explanation. And Ms. Chen, you look like you were maybe ready to jump in there too. Were you?
You know, I think I was kind of, quote, baptized by fire, because if I don't reframe myself, you know, I'm going to go crazy. Okay. So I do have to reframe myself, you know, and reset, realign. And fortunately, after a few of those practice, you kind of know how to do it. So you have to train yourself. You do and practice it over and over and over again, without just going to the other way. Do not go the negative zone. Always stay in the neutral zone and try to cross over to the positive frame.
And there's another question here. As a parent of a child just starting school with an undiagnosed neurological disorder, going through genetics research study to find the cause, where can I find support groups that cater to kids like mine? Her symptoms don't fit anything, so I'm not sure where to go. And also support groups for my typical child in dealing with her special sister. That is a really good question. And I think you all may have some answers about that. But there are certainly groups in Houston that offer more, if you don't have a specific diagnosis, that offer more general care. And I'm thinking of the Family to Family group, the Arc of Greater Houston, the Families Can, and I don't know if you all have any other thoughts of support groups that might help when a child is not yet diagnosed in a family.
Can I chime in on that? Since
Yes.
I'm a big proponent of support group. So with my daughter, I started with the ADD support group, but that doesn't fit her criteria. Then I end up with LD, then I end up with who knows what, you know, everything. But the truth about support group, the core is the same. And once you're in a support group, there's going to be enough information for you to know where the next support group should be. So always start with one, but that might not be the one that you call home. Remember, transitional life, transitional stage. So I would go, even if you just go unrelated support group, the support's still there. Trust me.
It is, and we can send out a list of potential support groups because statewide there also is Texas parent to parent. And then there is also the Mountain States Regional Genetics Network, and that has a Texas chapter. And that is another support group that can be very helpful and with a lot of information. The other one is Navigate Life Texas, and they have a lot of information too that will give you local resources in additions to the one that we've mentioned. So we will send this out with links to the websites and let you have them. As far as siblings go, I know Dr. Berry, in the autism clinic, you all have offered a SIB shop for siblings of individuals with autism or IDD. I don't know if they have one planned anytime soon.
Yeah, that's exactly what I was thinking about, Susan, is SIB shops. So we have done it in the past. We will do it again in the future. I don't have a specific date at this point, but to this parent, if you go on to the web, siblingsupport.org, you can learn more about SIB shops and the Sibling Support Project. And this is national. So there are, outside of Texas Children's and Baylor, there are other people hosting these SIB shops, but I'm really glad to hear that the parent is recognizing that, we tend to focus on our child who's neurodivergent or who has some kind of different needs, and our other children also have needs. And so I really appreciate and want to recognize this parent for asking what they can do to help support the sibling.
Gladys and I want to thank this panel. You all have done an amazing job. This is really fantastic. And I do think that the whole idea of being able to express forgiveness, being able to write down every evening 3 things, they can be minor, but 3 things you're grateful for, to really then have that pause for mindfulness so that you can go in a positive direction and know that there are experts out there that can help you with the transition planning. All of this, I think, is really important. And I think that it's incredible to me to see how this program has continued and extended. So I know I'm leaving it in great hands, and I am super excited about all the things that will come. So really, thank you all very much. And are there support groups for working parents is the question. And yes, there are. And they have events on Saturdays, or meetings on Saturdays, or meetings by Zoom. And so you'll be able to find the right one, and we will definitely send you the links.
And
So
we've even done some from Stress to Strength groups online as well. And we probably will also offer those in the spring. And so, keep your ears open because there may be one that better fits your schedule that's virtual in the spring.
yes, absolutely. And we're going to put the survey for this event on the chat, and in there, if you want to get on our email listserv, please do so. We send out a newsletter every couple of weeks. I think one of the other newsletters to get on is the one from the Myers Center for Developmental Pediatrics. They have a superb newsletter, and that gives you an idea of when events are happening there as well. And there are a lot of thank yous coming in, speakers. So I think this was a really, really helpful webinar. Thank you, Dr. Berry. Thank you, Ms. Wei-Chen Chen. Thank you, Dr. Kemere. This was awesome. And thank you, Margarita and Chris, for planning this. And I'm so excited that Gladys is my successor. So have a great evening, everyone.